let's look at vulvovaginal candidiasis. It is basically caused by the yeast Candida albicans in about 80 to 92% of cases, but other non-albican species may cause more severe and recurrent infections. For example, Candida tropicalis, Candida glabrata. Um, glabrata normally cause about 15% of the cases, and we have Candida krusei, Candida um, parapisilosis, and Candida stellatoidea. Okay, so these are just different variations of the Candida species. Okay, so basically, Candida albicans is a common commensal in the gut flora, also in the vagina and on the skin and under the nails. Is present in about 80% of the human population. Any event that disturbs the normal vaginal ecosystem can lead to overgrowth of Candida albicans, leading to candidiasis. 75% of females would have suffered a vaginal yeast infection by mid-20s. The classification of vaginal candidiasis, as you can see in the slide, we have the uncomplicated and complicated. The uncomplicated normally is less than 3 episodes per year from mild to moderate, and is likely to be Candida albicans. Normally occurs in non-immunocompromised women. For the complicated, it's very severe. It's also very recurrent. It it's normally occurs. It can occur during pregnancy. It can be caused by both Candida albicans and non-albicans species too. And usually, the immunocompromised patients normally present with that. So the risk factors include increased estrogenic states. For example, in pregnancy, when there is a patient is being given high dose of OCPs, um, and also estrogens in cosmetics too. Okay. Like I said, immunosuppression can cause it. Steroids use and in HIV and other viral conditions too. Broad spectrum antibiotics could lead to that, and uncontrolled diabetes mellitus too could lead to um, vaginal candidiasis. Vaginal douching, shower gels, poor inner wiping technique back to front, and bubble bath, tight clothing, the undergarment, especially nylon based jean strings, they could all lead to vaginal candidiasis. Note that synthetic pantyhose users are 3 times more likely to develop yeast infections compared to cotton users. Okay. So basically, when you are taking the history, um, normally there is itching of the vagina and the vulva, and sometimes it may become sore. There's a white, curdy, adherent vaginal discharge that may smell yeasty, or thin, watery discharge associated with dyspareunia and dysuria. For the physical examination, there may be vulval edema, vulval excoriation, redness, and erythema. It could be follicular white discharge of high viscosity, which is not present at the introitus but adherent to the vaginal walls with a yeasty smell. So the diagnosis is by microscopy and culture of the vaginal fluid. And culture is the most sensitive method currently available, using the selective suborod dextrose agar growth medium. Microscopy, there's a wet mount. You add 10% potassium hydroxide to the discharge, and there's a budding yeast and pseudo hyphae that forms. Molecular detection of Candida species using the PCR method may be done. And note that in vulvovaginal candidiasis, the pH of the vaginal fluid is normal, that is between 3.5 to 4.5. The treatment is basically with azoles and or imidazoles, and these are the mainstay of treatments. They may be used either as local, tropical, topical applications as pastes or creams or orally. Um, Clotrimazole 500 milligrams once or two of the 100 milligrams tablets inserted QDS for 3 days, or 100 just one of the 100 milligrams tablets um, inserted for 7 to 50 to 14 days. The clotrimazole cream applied twice daily for vulval irritation against um, this particular infection is very effective. So other agents like buconazole, butoconazole, teconazole, ketoconazole, and statin are very effective too. Orally, fluconazole or diflucan 150 milligrams single dose is also very effective. Treat pregnant women with topical azoles only. Recurrent infection is basically defined as at least 4 episodes of infection per year, or positive microscopy of moderate to heavy growth of Candida albicans. So whenever you see such a patient, you just refer. General supportive care. The other ways you advise on the use of cotton, you change and wash regularly, you sun dry, you avoid vaginal douching, bubble bathing, use of gentle perfumes and herbs, proper inner wiping technique, good glycemic control for diabetes, high dose estrogen, combined um, oral contraceptive pills should be changed to lower doses, and avoid recurrent causes of broad spectrum antibiotics. Complications of vulvovaginal candidiasis include urinary tract infections, oropharyngeal and esophageal infections.